Good afternoon, colleagues. Good afternoon, Professor Japhet Opintan.
Good afternoon, Prof.
All right, Prof. I'm not the professor. The professor would speak to us very soon. Prof, please, we want to give ourselves up to 4:10 to get some few more people to join. Then we can start the presentation. So kindly bear with us. Thank you.
We shouldn't wait for the latecomers. They should learn to respect time. Let's start. Next time they will come early. Even though they will know next time they will wait for them again.
All right. So on that note, we are going to start. So today's session, we have one astute professor of medical laboratory science, a professor of clinical microbiology. He's an associate professor with the University of Ghana Medical School, and he has scientific research background and coordinated several researches in Ghana, including the healthcare-associated infections in Ghana. He a project sponsored by Danida. He similarly coordinated researches involving antimicrobial resistance in Ghana and across the world.
They left the they no can take away the left the like by now we are better off.
Did anything go wrong?
So good afternoon. So on that basis, we are going to start. But before that, I will just introduce our speaker for today. Today's session will be a blend. We'll have a presentation from our mentor, and then we'll have time to interact with him and know more about him and how he started his research career and some of the pertinent questions we would have for him. I'll be doing I'll be co-moderating with one of my colleagues who will join us soon. So today we have Professor Japhet Opintan, who is a clinical microbiologist and an associate professor with the University of Ghana Medical School. He's a member of our professional body, GAMS. He's also a scientific research coordinator of the Healthcare-Associated Infections in Ghana, a project sponsored by Danida. He similarly coordinated antibiotic drug resistance monitoring and evaluation of resistance projects in Ghana and across Africa. He also served as a visiting research fellow in various universities, including the International Health Division of the University of Virginia and the Global Health Initiative Division of Biomed, Brown University, both in the US. He served as a visiting research fellow at the Department of Medicine, Wellcome Trust Sanger Institute, Cambridge, UK. He is also a member of so many organizations and one of the lead researchers in the Fleming Project, which brought a lot of good things to Ghana and our profession and the health sector as a whole. So today we have Professor Japhet Opintan, and I hand over to him to do his presentation. Then we go ahead with the other questions. Thank you, Prof. You are welcome.
Thank you very much. And
Welcome, Prof.
Yeah, thank you very much. So colleagues, it's a pleasure to speak with you this afternoon on this webinar. My name is Japhet Opintan from the Department of Medical Microbiology, University of Ghana Medical School. Again, it's a good pleasure. I must say that most of the time, because I seem to be so much occupied, I tend to be sharing away from some of these lectures because of the scarcity of time. But today I'm very much humbled to make this presentation and also to share ideas with you. So to make a presentation on how to develop the research man in you. And I guess this one, we are not leaving the women also out. Also, how to develop the research woman in you. What are you required to do? So the outline of my presentation will take this form. Like the president have said, or just like what Solomon said, I'll make a formal presentation, and this formal presentation, I'll give some introduction centering on what research actually means. And then I'll make 2 general quotes, and before dwelling on what is required to be a very good researcher. Then after, I would have the opportunity to share some of my experiences where I guess I will be interviewed and I share my experiences. Thereafter, I would have a Q&A session. So to start with, if we are talking about research, then we can have several definitions for what research stands for. But when I was preparing for this particular webinar, I came across a certain definition from the Western Sydney University's webpage, which I modify 1 or 2 things, but I think it still captures what research actually means. So research, if we are talking about research, we must have in mind a systematic way of conducting whatever we are doing. So we can define we can define research as the systematic creation of new knowledge and or the use of existing knowledge in a new and creative way to generate new concepts, methodologies, and also understanding. So if you look at the left slide of this particular slide, we have several books supposedly to be knowledge captured in these books. So what we are trying to say is that when we are carrying out research, then systematically, whatever we are doing, if we are counting, systematically, we must be doing the counting. And it is important also to note that you can carry out research based on existing knowledge, which is already there, or completely no knowledge at all, but whatever you are doing, you must be doing it systematically. And this could involve synthesis and analysis of previous research to the extent that what new findings you are coming out with will serve good outcomes. So in a nutshell, this is what research means. Then I would want to, like I said, give 2 general quotes before zooming in into what the requirements are. So I have this first quote, and I have said that research is a voyage through uncharted and charted waters. And of course, this also explains my initial definition of research. Some of the things it's already done, and you may be able to refine the methods to come out with new outcomes. So if you look at on this particular slide, you have a bottle with a cork on it, and this bottle is floating on waters. Of course, for this particular bottle, it can travel to anywhere, meaning that research can be amendable, or we can develop various tools to carry out our research. So if research is a journey that we have to be taken through charted and uncharted waters, then we must be bold enough to be able to step into the waters to start the journey. So we have to be positive. And along the way also, we have to be reassuring ourselves of success. In fact, if we start thinking negatively, then we will freeze up and will not do anything at all. And additionally also, I would want to say that being part of a research process or a research team is rewarding in several ways. I mean, I would be explaining some of these things later on. But what I want to say here is that you don't necessarily have to be, say, the PI or the co-PI. But whatever, if you are part of the process and you are contributing your quota to whatever is happening, it can be that rewarding both to yourself and also to humanity. The second quote that I would also want to touch on is to say that research is taxing in several aspects. And what do I also mean by this? Financially, you need resources to do research, and therefore you must have those resources to perform your research. This means that you would have to be competing with several other scientists to be able to get the needed financial resources to do your work. So financially, research can be taxing, but in situations where you have good funding, you would always be able to execute your research. Additionally, research is mentally also taxing. Yes, it's very good you say you win a grant and you are about to implement your research. But mentally, even right from your proposal writing stages, it can be that taxing mentally. You have to come out with new ideas. You have to come out with new thoughts and the rest. And finally, even if you have the finances to do the work also, it can be very taxing because you have to be reporting to donors your scientific work that you are doing, and financially also you have to be reporting to your donors. And this, I must say, that takes a lot of mental attitude and ability to be able to meet your schedules and timelines. So it can be mentally also taxing. Emotionally also, it can be taxing because for long hours, if you want to do research, then it means that you'll be staying long hours by your desk or on the bench or in the field trying to gather material or information for your research. We can talk about other several ways that research can be taxing, but I guess some of those things, when it comes to the Q&A part, we can elaborate more on those things. So these are the two upfront quotes that I want to put across, at least to start the discussions, the discussion rolling. So indeed, what are you required to do if you want to be a researcher or you want to be conducting research? In no particular order, I would want to be touching on some of these points. But I think, or from experience, what is most important and essential is for you to be able to clearly identify where your interest and passion lies. I can't foresee or envisage somebody doing something without passion. In fact, if you are doing something and you don't have passion for it, however even rewarding it is, along the line, I'm very sure that you get weary and you probably stop what you are doing. So it's very important to be able to clearly identify where your interest and passion lies. just because research is driven by passion. You have to have the passion to be able to come up with your research questions, and then after, the other things can follow through. So what are the skill sets or talents that you need also to be able to execute or to do your research? I must say that individually, we have several abilities and capabilities. So God has given us a lot of talents, and those ones, they are natural. There is nothing so much we can do on those things. But even the God-given talents that we have, there is always the need for us to polish that one and also to present it before kings, in quotes, to be able to make our arguments very well, and also to be able to attract even funding. So what I'm trying to say here is that, yes, we have God-given talents naturally, individually. We have different or several God-given talents. But even that one, we would have to polish it. We have to constantly be polishing those talents before they can be meaningful or useful. Aside these God-given talents that individually we have to necessarily also develop skills, some skill sets to be able to carry out our research and carry it out very well. So that means that there's a need for us to have some levels of training along the line, and these trainings must always be ongoing. We should not be stopping training and also learning how to acquire new skills. So now I want to delve into some of the critical things that we need. And on this particular slide, I have said that, or the caption reads that, chart the course before undertaking the journey. So let me, before I explain what I have on this particular slide, these days we have Google Maps and the rest. So for example, if I'm in Korle Bu here and I want to get to, say, Labone, a specific place in Labone, say coffee shop in Labone, I can just input my location here in Korle Bu, and the final destination will be Labone coffee shop. And with the help of internet and the rest, and also with the help of Google Map is supposed to be able to lead me to my final destination. Of course, along the line, I may have to reroute my navigation or direction. For example, if I decide not to follow exactly what the Google app is telling me. Similarly, if we want to carry out any research, we would have to be able to define our journey very well, clearly. In simple terms, we have to be able to define it very well. So if we want to chart the research course, then we must have a defined research goal, or we must be able to define our research goals. That means that so for example, I'm a microbiologist, and within the context microbiology, you can have various fields. So as an individual, I must determine where my passion is, exactly in microbiology, what I want to do, what my research question looks like, what areas of microbiology am I very much interested in. And that is what I meant by you have to chart your course even before the journey. And because research is driven by questions, you must be able to have specific questions or problems that you want to explore or advance. And when you have this clear focus, this would actually help you in your research efforts. So again, I'm going back to my chart, my quote, that you have to chart the course that you want to undertake even before you start your journey. What are some of the things that would help us chart our course or have a very clear questions that we would want to address or answer? In fact, if you want to be able to do good research, then you must read extensively. You must be able to immerse yourself in the existing body of knowledge related to your research interest or your research area of focus. You must, of necessity, read research papers, books, articles, and the rest. I must say that in these days, we have AI, artificial intelligence, and even in the web browsers and also in scientific databases, there is always the possibility for you to be able to set some alerts to receive information as and when they are generated. So for example, if you are working, say, on E. coli, you can set up some alerts within the NCIB webpage, for example, so that any new finding, and you can always tailor it to suit what your interest looks like, so that any new finding, any new paper or information that comes, you will receive it. And this helps a lot. And this can also help you to read extensively in your area of focus. And you must also be able to critically analyze any kind of information that you encounter or receive. So if you pick, for example, a research article, you must be able to analyze it critically, be able to identify what the issues or questions are, the methods that are used to address those questions, the findings, and how even the discussions are done. This is very key if we want to be very good researchers. And additionally, we must develop a critical thinking skill. We must be able to develop those things. And I must say that these things come with practice. These things come with a lot of reading. And if you are able to develop these critical skills, then you'll be able to question existing assumptions. And based on your question, your critical thinking, you may be able to come up with some new ideas that will look or consider alternative viewpoints other than what is already been established. And you also don't have to take any information just line, hook, and sink, just as it is. You must be able to interrogate the information very well and also to ask relevant questions where applicable. Because you want to be a very good researcher also, you must be familiar with some research methodologies. And for each of these research methodologies also, you must be able to appreciate the strengths and weaknesses if those methods are applied. And that would also inform your research very well. So, for example, you must be able to, learn some few various research methodologies, like I've said. And it is not only the research methodologies, but you must also be able to be conversant or knowledgeable about some new research technologies relevant to your subject area. these become very useful and handy. Having said this, whether you are writing your proposal or whether you have executed your work and you want to communicate, you must communicate and communicate it very well. In other words, you have to develop your research writing skills. And I don't know anybody, for example, who is born with good writing skills. Well, you could have some few people who may be talented along that line, but on a whole, we develop these skills as and when we are actively working. Okay, so you must communicate your research and you must communicate it very well. And you can improve this, your academic writing, and you can structure it very well. You can structure your arguments very well. You should be able also to present your evidence very well. I don't know, I guess some of you may have been reading papers from Lancet and the rest. For example, if you read Lancet papers, even the English that is written, how concise the information is structured and the rest, you can see some excellence in this one. And for most of us, I mean, there is no easy way by which you can go around this. You have to do this by constantly practicing, by constantly making attempts to write and write very well. So for example, you write, you can leave it, later on you pick it again, you read through, and as you continue doing some of these things, you will be perfecting your writing skills. There is one aspect of scientific writing also, which some of us somehow do not take it as important or consider it to be important. But I would want to say that it's very important. For example, adhering to proper citation and referencing guidelines. So whether you are even developing your research proposal and when you have executed it and you want to disseminate it in terms of publication, I mean, you would always have to adhere to good referencing guidelines. At the screening stage, whether at the proposal or whether it's the publishing stage, if you don't do some of these things correctly or rightly, your paper can just be put into the trash without any consideration. Okay, so these things, again, I'm emphasizing that they come with practice. Then we'll be able to develop our writing skills very well. Another aspect also, which is key if we want to be good researchers, is to be able to build networks and collaborations. These networks and collaborations will be very helpful if we want to stay in business and we want to always be getting the necessary funding to do our work, etc. So some collaborations or some networks can be lasting. Some also may be short-lived, never mind. Some will be very lasting, and you can always draw on this one. So we would have to be able to engage with the research community in our field. These days, things are very easy. We can be using web browsers, etc., to get closer to researchers in our field in other countries, those close and those very far away. And if we are also able to attend conferences, seminars, and the rest, and even webinars like this, we would always be able to have good networking and collaborations. It's also very important to be able to seek mentorship and guidance. And as we connect with the outside world and as we network with the outside world, we'll be able to have very good mentors that would literally hold our hands through this journey. And they will also be able to do it very well. So we should be able to seek mentorship and guidance from those that have charted the waters that we intend to charter. So connect with experienced researchers out there and other professionals all the time. And through discussions and the rest, you'd always be able to get a few times even what is needed to carry out your research, some consumables and all other things that is even needed to do your research. And on this particular slide, I would want to put this across that. So for us in low and middle income countries, for example, we may have, I'm putting in quotes, the disease. We may not have all the resources to be able to do the work in terms of the maybe equipment and the consumables. But if you have mentors out there who probably are also resource, but they don't have the, quote unquote, again, the disease in question, and we network with these people, we would always be able to have our research ongoing. So what I want to say again is that it is it's two ways. It is not just one way. Collaborations must always be two ways, not just linear way. It must be both ways. This probably is the last thing I would want to say, draw my conclusion, then we can have the interview. So I have said a lot, but whatever we are doing as researchers, we must be able to maintain good ethics and professionalism in our area or field. In fact, if we leave ethics out, then we are sure that along the line, our work will be shut down. And for some people, because they did not even maintain ethics, their whole career lives can be compromised or jeopardized along the way. So it's always good to maintain good ethics. We must be able to be familiar with some local and even some international requirements if we want to perform some specific research in certain areas. We must be able to be familiar with those things. In fact, for some research, if you want to carry those research out, there may be even the requirement for you to undergo some formal training, and you will be graded before even you will be able to do the work. This has to do with most of the clinical trials and the rest. You would have to undergo some form of ethics, some form of initial trainings before you can embark on those work. So to conclude on this, on my slides, I would want to say that knowledge is not in one person's head. And because knowledge is not in one person's head, we would always have to collaborate and network with others. In fact, these days, the big funds for research look at interdisciplinary research, where you are looking at multiple fields and the rest. So we must be able to do a lot of collaborations with people even outside our main domain research area and focus. And to conclude also, I would want to say that we would have to be positive and we must be able to start the voyage. If you look at the ocean as it is, it's very big. If you are not bold enough to put your first leg into the ocean, then you will not be able to make any effort at all. And I said this earlier, that being part of the research process or team is very rewarding in several ways. By this, if you are part of the research team, there are many benefits. Some are tangible, some are not tangible. Some are financial, some are not, and the rest. But so far as you are in the research process or team, and you are playing your part very well, some of these rewards will definitely come to you. And on this note, I think I would be sharing my personal experience in terms of interview, I think from the organizers. But before that interview comes, I would want to make this quote that in spite of my humble successes in my field of research, I do not claim myself to be an accomplished researcher, but I always try to give my best and to work very hard, upholding ethics and professionalism in whatever I do. Thank you.
Thank you very much, Professor, for this inspiring presentation. So on that personal note, we'll start with engaging you to know more about you. So we basically want to know who actually Professor Japhet Opintan is. Basically tell us about your educational background, a brief about your professional career, and then we can engage you. I'll be having two of my other colleagues who will also come in to engage you. Thank you.
Yeah, so thank you very much. So my name is Japhet Opintan. As many of you know, I'm an old Tom. I attended Aquinas Secondary School. Then after I went to, so both O-level and A-level, I did it at the Aquinas, St. Thomas Aquinas Secondary School. Then after I did my BSc at the Kwame Nkrumah University of Science and Technology, I read my first degree was in biological sciences. Then after I had opportunity to join the University of Ghana Medical School, where I had the opportunity to do my MPhil program in microbiology. Along the line also, I had opportunity to do my PhD, part of it in Ghana here, and also parts at the University of Virginia in the US. Along the line, I've had several opportunities to be visiting scholars in several US universities. Then also, my last one was a postdoc at the Wellcome Trust at the University of Cambridge in the UK. So briefly, this is my background as far as education is concerned. With my experiences, by God's grace, I had the opportunity to join the Department of Medical Microbiology soon after my national service, my post-university national service. I did my national service post-university at the Accra Technical University, where I did a lot of teaching there. Then after I joined the University of Ghana Medical School. And I must say that when I joined the University of Ghana Medical School, I met very sound, knowledgeable technical men on the bench. And I developed a lot of skills and knowledge also from these people. And I do not want to mention any name, but the technical men that I met on the bench actually helped and facilitated my development very well.
All right, thank you, Prof. So we want to.
Yeah, I'm coming. Yeah.
All right, thank you, Prof, for that. We want to know how you first thought about your first research idea and how that evolved to a paper, and did that idea got published, and what opportunities did you get from that?
Yeah, so thank you very much. So I think my first paper, research paper, was developed from my MPhil thesis, where I had opportunity to work on Shigella. So when I tendered in my thesis, the book, I started developing my thesis to be able to publish that one. And I must say that I did everything on my own by God's grace. Then when I have what I can say a manuscript, I shared it with Professor Newman to also look at it. And she was very much impressed about what I have done. I approached her and I told her that I would want her to be the even the corresponding author, and which she gladly accepted. We together look at the paper which was published in the Ghana Medical Journal, Ghana Medical Association Journal. So that was my very first paper. It was on Shigella. By then, these were causing a lot of problems. And there I pick it from that side. And I must also add that I was very much observant, and I was also very much prepared to take initiatives. So for example, by then, the Department of Medical Microbiology handles all the clinical data in terms of culture and susceptibility testing in the department. And one thing struck me, these days we are using LMS and the rest, laboratory information management system, but those days, everything was paper-based. And here at the department, for example, you find a lot of request cards which has been worked on, and with all the information just on the request card, which when you want to even file them, it's a big issue. So on my own, by then computers were just coming into the system. On my own, I started learning Access. And when I was able to just learn it, this information, I started trying to put them in the database, in Access database, all on my own. Again, this thing also just impressed Professor Newman, which we started carrying it out and the rest. And I must say that this actually also stemmed my interest for my current research, which is in antimicrobial drug resistance, surveillance, and the rest. I would end here for you to continue.
So you in your presentation, you mentioned that as a researcher, you should be a positive thinker.
Sure.
Should you combine negative thinking and positive thinking as a researcher? Because I think that sometimes you may also have to look at negatives of research or of ideas and also develop other ideas out of it. Do you always have to be positive?
I must say that you have to be positive in terms of carrying out the research, but the negativity should be maybe the outcome of your effort in terms of the output, but that alone should not freeze you and stop you from carrying out any research, because negative results are also good results that can form basis or inform other steps that has to be taken.
Okay, so at this time, I will hand over to my co-moderator. Jan, are you around?
Yes, please, I'm here.
Kindly take over, please.
All right, thank you very much, GS, and good afternoon to all of us on call. So, Prof, thank you very much for the wonderful presentation. I followed and taken some key points. So my first question to you is that, and I want to refer to your second quote, that research could be very taxing on several aspects of our lives. And one of the issues I'll deal with has to the mental element. And I can closely associate myself with this in my postgraduate journey. I think that it's not very easy combining mental issues and the emotional issue. And looking at your experience, you have been doing this for several years. How have you managed, such situation? Such that it doesn't really affect you mentally and then emotionally. How have you managed yourself in this regard? Thank you very much.
Yeah, thank you very much. I must say that this is actually very taxing, and you would definitely have to have a very good balance. Before I proceed, let me just share this with you. In my experience outside there, in the US and also in the UK, for example, I realized that because research is very taxing, maybe their environment tries to help a little bit. How does their environment help? So for example, when I was at the University of Virginia, for example, these are top scientists that have written very fat books and the rest. Very early in the morning, for example, I will try to get to my my bench very early. I mean, before 7, I'm there. Practically, I want to start some work before the others come and the rest. And around this time, some of these, outstanding professors, they would also be in already. In fact, that thing baffled me a lot. But I realized that aside this, especially on Fridays, they kind of shut down. So they will close early and, for example, get to the gym, push or lift some few metals and have kind of fun, at least for the Friday before. So they have a way of rewinding and starting afresh all over. For me, as a scientist, I must say that I faltered a little bit in that aspect, in the sense that from the beginning, there was nothing like fun for me. All the time, trying to follow the passion and be running here and there. So I wouldn't want you or anybody on this platform to go along that line, because if you go along that line, what may even happen is that you will realize that within your nuclear family and your extended family, nobody even knows you, because you are not able to attend any social gathering and the rest, and that can affect you. So it's a balancing kind of things that we must strive to have a very good balance, so that we will not just be running like a wheel all the time, but at a point where we would have breaks or sessions where completely we'll shut down and also refresh ourselves before starting, because we don't want to be mentally derailed, etc. I don't know whether I've done justice to your question.
Yeah,
we can add more.
All right, thank you very much, Prof. I think I've learned from it. currently, I am a postgraduate student, and I closely associate myself with this important lecture. I am very suspicious, and I have this feeling that doing research in Ghana, amidst all the issues that you have discussed, could be very, very unfriendly. And let me explain the unfriendliness. For example, our environment, when you go to our labs, is not well resourced in terms of finances, assessing grants. And let me share my experience. You know, as a postgraduate student, the government will give us some amount of money to be able to support our research. And the highest I've gotten so far is around 600 Ghana cedi. And I don't know how that would, yes. And I don't know how that will be able to support me in my research in any way. Now, my
Maybe
question to
maybe
you
you can just buy pencil.
So my question to you is that in your time of, I went through your educational ladder, and thankfully you went through the educational systems in Ghana. At the time when you were a student, did you also have that feeling? And what is the situation now? You know,
Good.
in terms of the environment and then supporting research and all that. Thank you very much.
Yeah, so unfortunately, I must say that things are getting worse, especially when it comes to the opportunities around our education. So for example, when I was in tech, for example, we were two in a room. I can decide even when I'm coming home to just lock my things and come and the rest. But look at the frustration that children go or students go through these days. Yesterday, for example, my daughter was telling me a picture that she was thinking that so literally she was pleading if I could help the picture. So frankly speaking, at the moment, I can say that it is quite tough if you are a student. But in spite of this also, at least at the moment, we have a lot of things that we can do online. And if we somehow are able to access online platforms, then it can ease a little bit the pressure. So for example, when I was a student, I mean, most of these things, you would have to physically assess them and the rest. But now you can sit, for example, sit in Ghana and access information maybe in the US and the rest. So yes, there are pros and cons, but we must be able to even navigate around what we have. Previously, I mean, you would have to have a very good laptop before you'll be able to do some work. But now, some of the phones that we even carry is powerful, and may be even more powerful than some computers that were previously used and the rest. So it's an issue of balancing things here and there. But honestly speaking, I mean, it is challenging, and you must have a positive mind before you be able to make good progress.
All right, thank you very much, Prof. And I think this will be my last question, then others would also come in. With your experience in research, both locally and then internationally, amidst these challenges that we have accepted and then discussing this afternoon, would you recommend anything that as a professional body, you know, and when it comes to research, I also believe in the human development and then capacity building, because we are going to be the drivers of the research, our interest and then passion, we are going to propagate it. Do you think that, or would you recommend anything that as a professional body could also do a mechanism or system put in place in any way to be able to support the manpower and then develop people and then their interest in research? Thank you very much.
Yeah. So I guess that some of these even webinars that we are doing is a very good platform to be sharing ideas and the rest. But as an association, this is some of the steps that we are, for me, is recommendable. But aside this also, as an association, You know, associations carry a lot of weight and power. So even within the association, if we are able, and of course, even within the association, we have various fields. Some are into hematology, biochemistry, this, that, microbiology, this and that and that. You see, if we are able to harness our resources very well, we should be able to come up with proposals that can attract, huge grants, which can be executed and also bring some reward to the individuals involved as well as the association itself. Let me use this example. So you know the ALSM, for example, this is it's an association, it's a body, for example. They are always able to link up with the African Union and assess grants. One of the grants that they have been able to assess is some of these Fleming Fund grants, which these are huge sums of money. Of course, they have the technical skills and they are able to execute it very well. What am I trying to say here? The association is doing very well. With time, if we are able to harness our resources very well in terms of the human capacities very well, we should be able to, position ourselves to attract huge grants. We could also align ourselves very well to be able to take up some critical research that should drive our nation. So on the spot, I think these are some of the few thoughts that maybe I can share. Thank you.
All right, thank you very much. GS, I think I'm done. Over to you. Maybe other people could also take over. Thank you.
So thank you very much, Jan, and thank you very much, Prof. At this point, we would open the floor for us to interact with Prof and ask some questions if we have. So you can just raise your hand. We'll call you to ask your question. So let's take first 5 people who have questions for Prof. I think it can be on his interview or any other aspect. I would have our PRO first to engage, then we'll have Stephen to continue. Thank you.
Yeah, thank you very much, GS, and thank you very much, Prof, for the wonderful presentation. I think the last part that you ended is what I wanted to check, how we may be able to move that aspect where the professional body will be able to assess the grants. In fact, talking of the human resource, I see it to be the very people who make up the professional body or the association. Like the ASLM example that you cited, working with the African Union. I want to believe members of the ASLM who have the capacity and the skills to write might probably be riding on that platform to use the power behind ASLM to come up with such huge grants. So I'm just seeking your advice. How do you think we can go by it that you are getting good grants? There might be other researchers in the association who also might be getting some good grants. How can we harness that opportunity and ride on the professional body so that we bring it in that light in terms of winning some good grants to be able to use this power to also be seen in the area of health research?
Great, yeah. So this is wonderful. I would begin by saying that what I have realized is that there must always be some kind of leadership and leadership direction, and to tease it out further, I would want to say that there must be some few that must be willing to, quote and unquote, sacrifice and also lead the discussions here and there. So definitely, whether we like it or not, I mean, some few must be able to sacrifice. And when those few people are sacrificing also, they must get a little bit comfort. I don't know whether I'm only speaking in parables, but I mean, there must be leadership. So for example, this webinar sessions, monthly thing that you are doing, the leadership is doing, is very good. And I would always want to commend this effort. So how do we move forward also? For example, some few people can be tasked to do A and B in terms of fishing out what grants out there or what the calls look like. And I mean, a little forum to share and discuss ideas, refine it, and also just attempt. I mean, there's no harm in attempting. I mean, there is a call. In most calls, for example, will ask for concept notes are there, and they may ask for so in the initial phases, for example, will not require much, and that will go through some screening where probably you'll be asked again to submit your full proposal. So the first steps may be ideas. So we must be at the watch out. And we here, including the leadership of this association, be on the watch out to be looking out, searching for some available or possible grants and the rest. Some few people can be called on board to come up with some concept notes here and there. And we trade it, and that may land to a very big thing. Thank you. I'm over.
Dr. Ajinjesi, are you still around?
Yeah, I'm around, and thanks to Prof. I know this has been tried before. Some of the presidents had put together a team of researchers and were tasked to, let me say, drive the grant agenda. But it's always the conflict of people might have the interest of their institution or their core jobs. And let's say there's a grant, say in AMR, and we put a senior prof on board. The likelihood that the drift may be towards the university, because that is going to count to his promotion and other things, probably may be high. So we will get in touch and see the modalities we can put in place so that there will be a kind of a win-win situation. At this point, not more of GAMS driving the financial operations of any grant, but if it's seen as, let's say, once you are putting in a call and you are affiliated to GAMS, then GAMS become one of the affiliating institutions, as well as the university and all the institutions you are affiliated to. So by and by, the institution gets incorporated into wherever the grant is going, and they will know the institution as well. But I think it's not worked out well, and we have to have that discussion to see how best we can get it happen.
Yeah, that's great.
Yeah, take over, GS.
All right, thank you. So, Prof, before Stephen comes in, I realized that as academicians or researchers in academics, your research is mostly clinical based. How are you able to blend between academia and the clinics to get your research done?
Yeah, so let me say upfront, for example, that when you come to academia, for example, you come to University of Ghana, KNUST, or for that matter, any other university within Ghana, you are either on the big blocks, you are either in the teaching field or in the research field. And within these two broad categories, for example, if you are in the teaching field, you are expected to use about 75% of your time to do your teaching. The other 25%, you are supposed to be doing research. When you are, for example, in the research arm, you are expected, it's opposite. You are expected to use about 75% of your time to do your research and the other 25% to do some bit of teachings and also training. So the way it is structured, is supposed to be a very good blend. And I must say that my experience at the University of Virginia in the US, for example, in fact, I wish we always had something like that in Ghana here. When it comes to research, they are always able to do very good research that translates into clinical care and also into diagnostics. And why? It's because I'm sorry to say that within Ghana here, there is always some kind of thin line between clinicians and also those doing the pure sciences. But my experience in the Virginia, they work together. You don't see anything. And they are always able to execute, again, very good research. So I guess here, and I'm happy that at least for now, a lot of things are changing. We can still do very good research if we combine both the pure sciences with the clinical sciences, our folks in the clinical arm. I don't know whether I've addressed your question very well, but basically this is what I see. We must somehow remove the thin lines which is preventing people to cross boundaries here and there. And if we are able to do that, we would always be, what do you call it, the winning people. I stated that being part of the research process and also being part of the team is always rewarding. If we consider and acknowledge this, it will be very beneficial to everybody. Over, please.
Thank you. So, Stephen, if you're online, kindly engage Prof. So Stephen is not responding. If anyone wants to ask questions, Gloria, are you coming in? I think the floor is open. Let's be a bit interactive. If you have any questions, you can unmute and ask.
Yeah, hello. Yes.
Yes.
Please go ahead.
Yeah, thank you. So, Prof, I'm back again. At least I could see you have quite extensive skills in publishing. And we've tried to always have this discussion that we sit on tons of data at the clinical level. The patients we see right from the world OPD across. And even now, when you look at the DIMS, which most of us might have access to, at least to our facility level. How do you think we can motivate ourselves in getting people to utilize the data so that at least that you may not even have to go to the field, but what we are already generating in the laboratories can still find its way out there? How do we motivate people to get that?
Thank you very much, Steve. I guess I don't have, I may not have the right answer, but I would want to say that as scientists, as laboratory scientists and the rest, we must be, there must be some drive coming out from us to be able to do some of these things. So like you have rightly said, if you look at CDC, for example, they are able to go into some of these limbs and the rest, 10 years, 20 years back and the rest. And that sort of analysis that will be done will be much, much, much more useful, even probably carrying out a prospective study to inform patient care and the rest. So to answer you, I guess that wherever we find ourselves, we must be we must have some kind of self-drive. When I was going through my slides, I said something that for any researcher, whatever information you are gathering, you must be systematic. So whether the information is already existing or it's new set of information that you are going to gather, the key thing here is just being systematic of your data capturing and the rest. So yes, you have mentioned limbs and the rest, but how many people or the number of people that have access to some of this data, are they willing to be able to maybe collaborate or dig this information and make it much more useful? Having said this also, let me put in a little bit of caveat. The kind of limbs that we have presently, for example, is it capturing the information as or in the format that it will be very useful to conduct any form of analysis? So for example, if you have limbs which is not capturing the information at the patient line level, and what you have is PDF and the rest, you will definitely not be able to do much. So right from the procurement of some of these limbs, as an association, probably we must be able to either make some contributions into the kind of limbs that we need. For example, probably I'm deviating at this point, but these are some of the burning issues that I have, where, for example, you have limbs that if you probably look at how it is structured, probably it is only looking at the revenue side, but in terms of the core data to drive and inform patient care, to inform research and the rest, some variables are not captured very well, and therefore you will not be able to. But on the assumption that these limbs are capturing the information very well, then I must say that as laboratory scientists, medical laboratory scientists, wherever we are, we must have some kind of drive to push some of this agenda for publication. And if we are able to do some of these small things, we can use it to trade off, to network, and even to get some funding for some new work that we want to do. Thank you. Over.
Yeah, Prof, thank you very much. And maybe before my other colleague comes in, so we are collecting data, and you always want to draw that thin line between health research and clinical care. So most of the data we are gathering in our hospitals are mainly for the care of the patient. And ethically, you may want to seek approval before you can even utilize the data. So thinking around it, do we as an association have to start thinking of getting some of these policies through so that patients that come to the hospitals probably may be consenting for possible review of their data, records, and other things, though it's not going to point to individuals, but the anonymized. Do you think there's something we may want to drive?
Certainly is something that we'll have to drive. Of course, whatever will be published and the rest or analyzed and the rest, it will be anonymized. So that should not pose any ethical issues or concern. And I must say that for some even places, boldly at the consulting room, I mean, you have some information there stating that the information that you provide can be somehow used for research and the rest. I don't know whether it is here, but maybe outside there, I've heard some of those things. So as an association, I think we should be able to push some of these agenda.
Okay, thank you very much. Yes, please take over. I can see some hands.
All right, so Stephen is back. Stephen, kindly go ahead, followed by Maswa and Obed. Maswa, go ahead. All right.
Okay, well, thank you so much. Please. Okay, so Prof, thank you so much for presentation. In fact, we have been taught a lot, and thank you so much. The question is that, Prof, probably when we start, somebody can serve as a mentor to us, but actually some of us want to venture into it for our first time. And also, please, Prof, my last question is that what is your advice for the young one who has just entered into the field as a medical laboratory scientist or working as MLT or any other portfolio? Please, what is your advice for us, the younger ones who have just come in service?
Please, I don't know whether it's from me here. You were not audible enough. If the question can be repeated, please.
I think, Prof, what he's trying to say is that as young people who have just entered the field, what special advice do you have for them? Are you ready to take them as mentees? If those opportunities are available, how they can link up with you? Thank you.
Oh, okay. So thank you very much. I must say that I am available and I try as much as possible to keep my doors very open to everybody. It is just that these days I find myself very occupied with a lot of administrative issues, managing grants and the rest, but I'm always available. You can always have a little bit of me for mentorship. What I want to say is that for most people, they think if they are the mentee or they have a mentor, it must be quote unquote that formal. But you can be a mentee or a mentor in several informal ways. Okay, I mean, so please, in short, my doors are that open, and as much as possible, I want many people to come on board so that I can be a little bit free. Thank you. Over.
Thank you, Prof. So I'm sure Prof will share with us his email address. I have it, but I'll seek his permission. Then we can share so that we can correspond with him. Maswa, please.
Okay. Yeah, thank you, Prof, for the insightful presentation that you've given us. My own is a bit of a question. Like, I remember when you started National Service, we wanted to make some publication. We did a research project, and then we sent it to Pan-African Medical Journal. But at that time, we didn't have enough funding, and I refused to withdraw the article and then publish it, the free publishing one, not knowing that they had banned me. So my question has been that in our setting, especially those of us who are just coming up, finding the source of the kind of amount to pay in dollars to get it published at the most recognized publishing house has been very difficult or challenging. What advice will you give us? For instance, in my case, I didn't even know that when you don't publish with them, they are going to ban you. Now we have a project with them. We really want to publish with them, but for the past 2 years, even the editor is not responding to our emails again because of what we did previously. So what advice are you going to give to us, those of us who are coming, especially in selection of journals to publish some of the few works that we are doing with them. Thank you.
Yeah, so thank you very much for your question. I want a little bit of clarity on what you have just shared. Are you saying you submitted the manuscript and because you did not have so you didn't withdraw it?
We submitted the manuscript, they accepted it, and at that time we were doing national service, so with the $180 we couldn't pay, and I had not read their policy, not knowing that you get banned for going through, and then I published a different house, and then now that we want to publish one article with them for the past 2 years, I really want to publish it with them. They are not responding, and I think that it could be as a result of us publishing without withdrawing it from them. So what advice are you giving us? And then also in selection of some of these publishing houses, what are the things that we should look out for so that we don't just waste our data and then the good work that you've been doing?
Yeah. So let me start this way, that there are a lot of predatory journals out there. And for any good work which you have done, you would want to be sure that you are not pushing it into any predatory journal. And what are these predatory journals? These are journals that are not recognized. They are not in any database, and they are kind of scammers. They take your money, they just publish without any proper reviews and the rest. But coming back to your question, like you have even just answered yourself, you didn't pay much attention to their policy guidelines and the rest. So my first advice is that if you identify any recognized publisher where you want to publish your work, please pay a little bit of attention to their policy guidelines and the rest. This even goes to how they want you to structure your manuscript and all the rest. On that one, I don't know how best it can be addressed and why you necessarily want to go back to that same journal. There will be thousands and thousands of journals out there with equal, maybe impact factor or even more and the rest. So, I mean, you just have to search, you just have to comb so your field of study or your field of research, for example, what are the top ranking journals, for example, what are the middle ranking journal and the low ranking journal, and depending on the quality of your work, you want to push it to these journals. In terms of the funding, so for most grants, for example, they would provide money that you can use for paying the article processing fees, for example. They may also have some restrictions here and there and the rest. So the choice should be for you and your research team what you really want to do. There may always be some online journals that will be free, and some may also give some concessions to those of us coming from the low and middle income countries. So there's no fast rule. You just have to be patient. You have to be able to try. If you are knocked down or you are turned down at one particular place, it should not be the end. Please pick the comments, especially if you had the opportunity for your article to be reviewed. Pick the comments, use it to upgrade your work and push it to the other possible journal, and it may just go through like that.
Okay, thank you.
But where they want or the requirement is money, I mean, the best you can do is to, get the funds to do the APC fee, but that should not come from your pocket. Okay, that should not come from. It should come from your grant and the rest. If you are starting afresh, maybe you can put your heads together and contribute and pay. But moving forward, I mean, your grants and the rest should be able to pay for those things. Thank you. Over.
Thank you, Prof. So there are some nice comments for you. We have one from our colleague, Jacob Ankra, who said you supervised his work some time ago in typhoidal and non-typhoidal sammelinosis. So he said he's happy you taught him. Thank you very much.
Yeah, so let me say, okay, before you continue, I must say with a lot of humility that the first people that I mentored, I really gave them all my time. They really had a bit of me. Jacob is one, Kuma is one, and there are several others. Recently, those that I mentor, I still do my best, but those initially, they really had a bit of myself. Thank you.
Thank you. I think Kumalu. Yeah. Yes, it's also here. He has put a good comment for you, and is happy to have you here again.
Oh,
we have a question in the chat that what are some of the ethical issues that arises in your research, and how have you been able to overcome them? Okay, so thank you very much. So thankfully, most of my current research has to do with surveillance. And for surveillance, you don't necessarily need, what do you call it, ethical approval, though in some aspects, maybe that will be a requirement. But I don't think, so some of the ethical, I don't think I've had any big issues with ethics. But of course, before you start the work, you want to go through the institutional IRBs to make sure that at least your proposals and others have been approved and the rest. So for those ones, these are requirements that you can't go around. You of necessity have to satisfy those requirements, where you have to seek the necessary permissions from the various facilities and the rest. You necessarily have to go through. You see, if there is the opportunity also to do some community entry, I mean, don't cut corners. Please, you would have to do it. These have positive outcomes. If you say you would want to dodge those things, you may run into big problems. So for example, you are doing community study where you are collecting stool specimen. If you don't do the appropriate community entry, this information, I mean, a negative information will be circulating that you are collecting stools for money and the rituals and the rest. That can be that terrible, and you don't want to enter into such problems. So please, I've stated in my slides that ethics and professionalism is very key. Please don't cut corners. Go through the necessary ethics to do your work. And when you get your data also, there may be outliers and the rest. It's part of the research. You are charting you are making a voyage on uncharted waters. Don't massage any information. I mean, clearly discuss the outliers as they appear and the rest, and you'll be free. Thank you. Over. No mind. Thank you, Prof. Obed, please engage Prof now.
Okay, thank you very much, host. In fact, I must really say I'm grateful and I thank you for this opportunity. I work at Sunyani Teaching Hospital with Dr. Kumalo, who is a Prof's mentee, and I've heard a lot about Prof. In fact, so it's an honor. So I would just like to use this opportunity. From what we've heard from Prof and even the AMR work, Pfizer work, glass work we've been doing, if there is an opportunity, Prof could always, let's say, organize some mentoring sessions, maybe once in a while, because we know that very soon they are aging out. The likes of Dr. Kumalo, George Kumalo, Kumatu will also go out, so that we, the young ones, can always have the opportunity to learn from them. And then especially on how to secure grants for research work. It's something that we lack a lot amongst the upcoming scientists. And then the next question is also about, when you look at the country, we have few laboratory, medical laboratory facilities. So is there a way that Prof could maybe push, or in his own way help the system in such a way that we can have more medical microbiology laboratories, like expanding, or research places starting in other areas in the country? Thank you. Over.
Yeah. So to start with, thanks for the nice comments that you make. I guess you are doing very well in Sunyani. Some of the things actually goes beyond me, and I think GAMS can be pushing a lot. And I know they are doing that very well. If we are talking about equity in terms of assessing diagnostics and the rest, the association is better placed to be pushing that agenda. Coming to the research grants and the rest, there would always be opportunity. And I must say that for yourself also, it's always good to have a research idea that you gradually be developing. When they make calls, research calls and the rest, and it is fitting into what you have, you can always refine what you have and push it. And at this point, I'm also offering myself, wherever possible. I should always be able to guide and guard some of you to be able to secure grants here and there. Thank you. Over.
So, Edward coming in, then we'll be rounding up. Thank you.
Sure.
Yeah, hello. Thank you very much, Prof, for this insightful presentation. May I please know, have your manuscript been rejected before, seeing that you are one of the top-notch reviewers? and why is it that postgraduate education in our part of the world is quite stressful? Sometimes you have your supervisors not reading your work. I don't know whether it's intentional. They delay you. Course that is supposed to take like 3 years, 4 years, you end up sometimes 5 years, and students are left without any option, frustrated. Sometimes you don't even know where to complain, who to complain to, and where to go to. So what is it that is causing some of these things in our part of the world, seeing that you have exposure with other universities outside? Thank you very much.
Yeah. So let me start with the rejection bit of manuscripts. I must say that if you submit any manuscript and it is rejected, that should not be a big challenge at all. If you have the reviewers' comments, you can always use it to improve your study. So to ask to whether I have been rejected before, I must say yes. Recently, I was rejected, and it's just because of on some technical grounds. But the issue, for example, that they raised, I have addressed it, and over the weekend, I will just push it again. So right from, technical issues. So this is a research which we have done. For example, we had the first ethical approval, but along the line, I put a student to do some aspects of the work. The student also went through the review process and had approval. And when this work was done, I asked the student, in fact, the student did very well, made the first draft and all the rest. So even the submission, I asked the student to do all those things. And at the point that we were submitting the article, instead of sharing the approval letter which I received, the student's own was what was shared, okay? But per the journals committee, they said that our paper looks like the work started before approval. But in actual fact, that is not the case. But because probably we were not very particular and shared the students' one, it was rejected on technical basis. So your work or your article can be rejected based on several factors. But the good thing is you always have opportunity to address issues where possible. If they are such that you can't address them, you can just polish it and send it to another journal. It may be accepted wholeheartedly or 100%. Coming to the issue of supervisors and the rest, and vis-a-vis how stressful it is to do work in Ghana, it's difficult to address this. But in fact, now that I'm also a lecturer and a mentor, I better understand the issues. I understand the issues better, in the sense that students' numbers, if you look at lecturers, supervisors, ratio to students, it's always ballooning. And it makes life very difficult, very, very difficult. I must, at this point, also acknowledge some of my mentors, being Professor Newman and Professor Wilson at Noguchi by then. You know, by then, when I was a student, we were MPhil, we were just about 3, for example. They had time, you send a document to them, overnight, they are able to look at it, give you feedback the next day. That made life that comfortable for both for the student as well as the lecturers. Now, for example, that you have one lecturer to about 10 students, having to review all the things that are written by students is challenging. So one way to go around this as a student, I would say, is that before the work goes to your student, like goes to your supervisor, try as much as possible, put in a lot of effort yourself, read extensively, so that when your lecturer starts reading it, he or she will not feel like putting it down to go and have a dinner first to get a lot of energy before picking it to read again. Okay, so do as much as possible. If your writing skills is very good or better, it will encourage your supervisors also to immediately you give things to them to quickly go through and give you feedback. So that is, in my opinion, that is one way you should be able to go around it. Do a lot of diligence in your writing, okay? Don't just write and just push it for your supervisors to do the editing, do the grammar and all those things. You see, do those things yourself for your supervisor to do the guidance, the mentorship, how things should be flowing and the rest. I think that is what I want to say for now. So it is challenging, but both lecturers and students must be able to go around this. Thank you. Over.
Thank you, Prof, for time well spent with us. We are inspired by your presentation and your interview. Finally, to just, I think one of our colleagues, Obed, made a suggestion which he threw back to the professional body GAMS. I think what we'll do is to facilitate the process as a professional body, bring people like you and other key researchers in the area, provide a platform so that people who are willing, you can engage with them over time when you are available. So we'll come to you once again with these proposals and hope that you make some time available for us to mentor us and get more researchers like you in our system so that we can win more grants and develop the health sector. One of the good things about the grants you are working on is that I know some labs, including the Korle Bu Teaching Hospital, we've had retooling of our equipment and other infrastructure, which is a good thing. So it is not just papers being published, but the labs are also benefiting from it. So we are grateful for all this, and we hope and pray that you will win more grants that will reflect into our labs, and also we, the young ones, will also benefit from your works. On this note, we want to say thank you to you on behalf of the National Executive Council, the President, and everybody on the platform. We are grateful. We cannot pay you for the time you spent with us. I know you are a big time consultant. This would have cost a lot of dollars, but it's a pro bono work, and we are grateful for that. And God richly bless you. That is the only thing we can say. Thank you.
Yeah. Thank you also very much for the opportunity to share some of my humble experience to colleagues. I'm also very grateful, and I'm happy to do more. Thank you. Over.
Thank you. So at this point, we say thank you for coming. Next month by this time, we'll have another person joining us to also share his thoughts with us. So join us that time. Bye for now. Thank you.
Bye-bye.
Bye-bye. Bye-bye.
Bye-bye.
So like we did in that session, the placement.
Thanks, Prof.
Bye.
Bye-bye to everybody still online.